The Nurse and Health Worker Protection Act of 2015. Created and narrated by Beth Buickerood, Rutgers University, Camden. Professional Nursing Seminar, Spring 2022 with Dr. Wanda Williams. In 2014, just 1 year, 11,360 registered nurses suffered injuries while assisting patients and performing their jobs. Terry Cawthorn, who worked at Mission Hospital in Asheville, North Carolina, was just one of these nurses. According to her supervisor of over 20 years, she was one of their most reliable employees. On her 45th birthday, Terry and a coworker were helping a large patient who just had a cesarean section from the gurney back to the bed when she felt immediately a hot tar sensation going from her back to her butt region. By the end of Terry's shift, she could barely make it to her car, let alone off the floor of her home, until her next shift the following day, where she reported immediately to her supervisor the injury. In the next 9 months, she had minor back injuries that she also notified her supervisor of immediately. All of this led to a lumbar interbody fusion, an operation requiring metal to surround the spine to offer support that her spine was lacking. When Terry tried to apply for a workman's compensation, Mission Hospital declined the claim and viewed Terry as no longer fit to work. They handed her termination papers while she still remained in the hospital. Kim, a labor and delivery nurse in the next clip, also speaks about these types of injuries. These injuries forced Congress to step in and begin to pass a bill where nurses have the tools and training necessary to succeed in the workforce.
I did not take care of my back when I was a nurse, a labor and delivery nurse. The nature of my injury was basically I took care of a large woman and had to hold her leg up for a very long time and sustained a torn muscle in my lower back as well as 2 herniated discs. In addition to her size, and so her leg was quite large, I didn't take breaks. I had not raised the bed to a point that was really safe for my back. I'm sure I didn't use my thigh muscles to sort of hold the leg in a good way using body mechanics. So I was really using my lower back. I'm sure I twisted, in these funny positions to try to hold her. And she was getting frustrated.
Injuries such as these were causing workers' compensation claims, shortages of nurses, permanent damage to nurses, and risking patient safety regularly. The goal of Congress was to institute a bill that would provide proper training and proper equipment to all facilities to assist in the job of nursing. Representatives John Conyers Jr. and Al Franken took the lead when proposing this bill in 2015 that passed in Congress with no issues. The bill incorporated Occupational Safety and Health Administration trainings, or OSHA trainings, called Safe Patient Handling and Mobility, or SPHM, to be reassessed and completed annually by every medical facility with updated maneuvers to ease the health of the nurse, updated equipment to assist in the movement of patients and ease of a nurse's job, and a collaborative approach to moving patients to allow the burden of weight or awkward motions to be placed on several colleagues instead of one particular nurse. The impact on the patient and community care was so significant as it created several things that helped patients and the community. It created consistency in the workforce. It promoted an increase in interdisciplinary teamwork in cases. It decreased the number of injured nurses helping sick and injured patients. It eliminated the incidence of patient injury and accidents caused by nurses' pain. And according to the American Nurses Association, since the bill passed in 2015, patient falls, friction burns, dislocated shoulders, skin tears, bruises, and nursing injuries have all been reduced by a 95% threshold. In addition, the quality and safety education for nurses was fully followed when this bill was instituted. Teamwork and collaboration was the number one key to making this work. Informatics, while they created the new programs and the annual trainings that go out every year. Quality control allows each patient and nurse to know that they are being trained the same way every time and know that they're going to be moved the same way every time, which also related to patient-centered care. And all of this, as evidenced by the statistic in the previous slide from the American Nurses Association, shows that this was evidence-based practice that based this bill off of. With every bill, there are pros and cons. The pros definitely outweigh the cons of this bill. Pros being better overall health and nurses and healthcare workers, better working conditions with updated equipment. Patients are safer with implemented new practices, new equipment, and properly trained nurses. Nurses can feel more confident in their skills, leading to longer lengths of employment in their chosen field without injury. And successful HPHM programs have proven to save thousands of dollars per nurse due to lack of injuries and reducing turnover. The cons, however, is the startup cost of creating a successful SPHM program can be costly, with it costing for training materials, new equipment, and maintenance of new equipment being quite significant. Nurse and patient ratios can be affected each year during the annual training times, leaving shortages on the floor. And no training is foolproof. It's not foolproof for the nurse, and it's not foolproof equipment-wise, as equipment can be prone to failure at times. The biggest endorsement to this bill created by the Congress came from the president of the American Nurses Association in 2016, Mrs. Pamela F. Cipriano, who was quoted in saying, "Manual lifting is an unacceptable risk and practice when we have the technology and knowledge to significantly reduce injuries. This bill signals that workers are not expendable and injuries are not tolerable as part of the job. It is a much-needed step in the right direction to implementing safer programs that will help save and extend the careers of thousands of registered nurses." In conclusion, this bill has promoted new nurses to come into our industry, as well as promoted safer well-being for the patient and the nurse as they move patients and use the proper equipment that now each facility is expected to have.